Is called Making Dolls in Art Therapy. There is much literature available and many studies have been conducted on the benefits of using dolls within the care setting for people with dementia. However, I am researching the effects of using art dolls within art therapy to explore grief. I also wanted to include healing and being, but 10 minutes just isn't long enough. Grief can be anticipatory grief, trauma, bereavement, divorce or a change in relationship, personal illness or the illness of a loved one, losing a job or facing financial insecurity. We can also grieve for things that we haven't necessarily lost, but that we never had in the first place, such as the loving parent, the perfect soulmate, the empty womb. My focus will be on grieving after the death of a loved one, with the aim to show that by making art dolls, participants can process grief and heal. Long-term benefits include participants to be in a comfortable state of being and even growing, discovering who they truly are as individuals. All images are of my own creations. As a young child, I was fascinated by dolls. I was a lonely girl who struggled to fit in, but I was perfectly happy in my world, surrounded by my handmade best friends. Reluctantly, at the age of 16, I packed my mates away and stepped into adulthood. It was many years later, on this course, that I was introduced to the doll making workshop, and it planted a very important seed that has been busy, albeit slowly, taking root ever since. It wasn't until my dad sadly passed away that little seed finally bloomed. Death is a natural part of life, and yet it can provoke very unnatural emotions. When we lose a loved one, we lose part of ourselves. We can be plunged into darkness. This is how Francis Weller describes grief in his book, The Wild Edge of Sorrow. He then goes on to discuss finding nourishment from grief and how we can develop a healthy living relationship with loss. We can learn to recognise that grief is not here to take us hostage, but we can in fact grow through it and become our mature selves, living in harmony and balance with grief and gratitude. He talks about soul activism, ripening our hearts and making us available for the greatness of loving our lives in this amazing world. Therefore, he argues that grief is essential to finding and maintaining a feeling of emotional intimacy with life, with one another, and with your own soul. In contrast, Brené Brown talks about grief in her book, Atlas of the Heart. It's often hard to find our way back into our bodies after experiencing anguish. This is why so much effective trauma work today is not only about reclaiming our breath, our feelings and our thinking, but also getting our bones back and returning to our bodies. So if we return to consider Weller's theories about becoming beautiful beings through the process of healthy grieving, we must also consider the contrast of mourning becoming a mental illness that needs medical intervention and treatment. In Shades of Grief, Virginia Hughes questions at which point grief and mourning become pathological. She explains that complicated grief disorder is in the DSM-5, and there is a controversial proposal to treat depression in the first few weeks following a death. Complicated grief disorder is also known as traumatic or prolonged grief. And Hughes explains that the concept of pathological mourning has been around since Sigmund Freud and his concept of the shadow. She highlights key points from studies of widows who sadly suffered with severe, long-lasting grief in the 1980s and 1990s. Researchers noted that antidepressants did relieve feelings of depression and worthlessness. However, they did not help at all with other aspects such as pining and intrusive thoughts about the deceased. More recently, Hughes looks at a study conducted in 2008 to not only widows, but of parents who had lost a child and explains how researchers confirmed the initial findings from the 80s and 90s. Hughes then discusses Mary Frances O'Connor of UCLA, who scanned the brains of women who had lost their mother or sister to cancer and compared the results with those experiencing typical grief to those suffering from prolonged unabated mourning. Whilst inside the scanner, all of the participants were showed images of their deceased loved ones. Both groups showed a burst of activity in the part of the brain responsible for pain. However, the women with prolonged grief also showed increased activity in a nub of tissue called the nucleus accumbens. This part of the brain is the reward centre, and it also lights up on scanners when addicts look at drug paraphernalia or when mothers see photographs of their newborn babies. It does not mean that women are addicted to their feelings of grief, but rather that they still feel actively attached to their loved one. Hughes argues that there is a need to include pathological grief in the DSM-5 so that sufferers are able to get a diagnosis and subsequently receive treatment that they deserve. However, it's a dangerous line that we edge close to crossing when pathologising the death of a loved one within 2 weeks. She questions whether it is for the gain of the patient or pharmaceutical companies. Moving from the brain to consider the whole being, Levine looks at research that has shown how the body holds on to traumatic events as memories, and they are stored in an altered frozen state. They can continue to affect the body on a daily basis, presenting themselves as chronic pain, illness, or addiction. Grief can be a very lonely and isolating experience, as it's a very personal journey and unique to each individual. Therefore, it can be difficult to feel understood or to have a sense of connection. Levine goes on to state that trauma can not only be healed, but with appropriate guidance, it can actually be transformative. In the book, The Revealing Image, Joy Chevrin states that creating art acts as a scapegoat, in which emotions are transferred into the art making. The end result is a body of work which encapsulates emotions and enables the art maker to have a liberating sense of freedom. However, Philippa Perry asked the question, what happens to all your love when someone dies? She expressed her thoughts on Grayson Perry's Art Club, Series 3, Episode 1. You have to pour it out into something, and it's not trivial to make art out of it, not at all. Sometimes it's the only thing you can make sense of it with, because it's beyond words, which is exactly the same belief as Cassandra Light and her book, Way of the Doll, The Art and Craft of Personal Transformation. Reading her book has watered my seed and kept it in bloom. Cassandra Light used to teach doll making workshops for many years to help people through their journeys of grieving. Her book captivated me so much that I had an email conversation with her to further discuss her workshops and background. She explained that she based her practices on the stories Vasilia the Wise about a blessing doll given to her by her dying mother, and also the myth of the Greek gods Psyche and Eros, who overcome obstacles in order to achieve the happiness of love. Another story that she bases her teachings on is The Handless Maiden, which is a beautiful German fairy tale about self-sacrifice and how beauty comes from the heart. She combines the myths and fairy tales with doll making, and she believes that these objects have spirits. They are a container or a vessel to both hold and express grief. Funeral objects have been a thing since antiquity, and her belief is that most people have a desire to make and have figures to communicate with. However, she expresses her concern that crafts have been considered a lower form of art. But today, we have an opening to change this and enable people to embrace their need for a comforting reminder of their loved one. So the final piece of art, or doll, or bear, becomes a transitional object, a talisman of their loved one. The creator can release negativity as well as love, and they are left with a figure that represents and contains all of the cherished fondness for their loved one. By creating a doll form of their beloved, they are able to explore their own identity while simultaneously keeping memories alive. Such is the case with Lisa, a 16-year-old who was referred to art therapy 1 year after the death of her sister Laura. The case study as outlined in the paper, Art Therapy Applications of Dolls in Grief Recovery, Identity and Community Service. The doll began as an outlet for her grief of her sister who was tragically killed in a car accident. She specifically chose items that represented her sister, such as purple ribbon to make Laura's ballet slippers, as she was a keen dancer. The sessions allowed Lisa to reminisce about her bond with Laura and also review her own childhood. The whole doll-making process led Lisa to a deeper resolution of grief and a positive sense of self. Lisa identified Laura's greatest talent and passion and decided to develop her own dancing skills in her sister's memory. Losing somebody special is physically and emotionally painful. Daily reminders can be a gut-wrenching trigger, and so it would be easy to avoid places that are a reminder. But by having the love contained in a physical form, the reminders become bearable and even enjoyable. Currently, there is limited literature on the broad benefits and value of healing through the use of art dolls within art therapy, and research has also been tricky to navigate through due to the popular uptake of cuddle dolls to soothe patients in care homes with anxiety caused by their dementia. However, I believe that the benefits and value of grieving, healing and being by making dolls is worth pursuing. I did actually write a couple of slides about professionals making art dolls to enhance their careers, to learn about leadership as well as themselves as leaders. But yeah, 10 minutes. I also found an interesting similarity between neuro images of people with Alzheimer's disease and PTSD. And it got me thinking, if doll making can support people in their recovery from PTSD, and this recovery can be identified on brain scans, what else can doll making help with? Alzheimer's disease and all other dementias are degenerative diseases or illnesses, but could actively making dolls slow down the progression, especially where the dementia affects the medial temporal lobe, the hippocampus, and or the cingulated cortex. So, for my dissertation, I would like to include making art dolls for healing and being, and add my own studies through workshops on the potential healing power of making dolls to aid participants through their own individual journeys of life and death. Thank you very much for your time, and I will now pass you over to present day Linny to answer any questions you may have. Thank you.